It's time for our weekend daybreak health segment with Dr. Randy Fagin, who answers your questions about men's health. Good morning, Dr. Fagin. How are you doing?
Good morning, Quita. Very well, thanks.
Well, November is American Diabetes Month. It affects over 50 million people, but what are some of the signs that you might be suffering from diabetes?
You know, it's hard because diabetes really doesn't have any hard and fast things that it actually causes. It causes a lot of problems, but the best way to find it is to be seeing your doctor on a regular basis and to check either your urine or your blood for sugar levels.
Now, how does this disease directly impact men's health?
Oh, in an enormous number of ways. We can break it down literally from head to toe. If you start with somebody's eyes, diabetes is actually the #1 cause of new onset blindness in men due to the vascular disease aspect of it. And your heart, #2. Diabetes actually is increasing the risk of heart attack in men by up to 6%. Huge increased risks of death with diabetes in men. Then we move on down, erectile dysfunction, ED. Men with diabetes have an increased risk of ED. In fact, they experience ED 10 to 15 years sooner than men without diabetes. And then moving on down to your circulation, especially in your feet. Circulation is affected by diabetes, and in fact, diabetes is the #1 cause of non-traumatic amputations in men due to poor circulation in their lower limbs, their feet.
So basically what you're saying is a man not treating his diabetes can be extremely dangerous.
Oh, absolutely. And what's unfortunate is so many of these problems are very, very treatable. It's very easy. Things like diet, exercise, some oral medications, seeing your doctor and checking your glucose levels, or checking them at home. There are simple blood glucose monitors that allow you to check your glucose at home, typically around mealtime and at bedtime. And these simple steps can not only help to improve your sugar levels, but extend the life of men with diabetes.
Now, I know the American Diabetes Association recently released information about men with diabetes. Can you talk a little bit about that?
Yeah, very sad actually. It's really about lack of information. Men with diabetes, 30% of these men had very little knowledge about their disease state. In fact, 25% of these men weren't even following basic diet and exercise protocols. What's good though is over 60% of these men wanted to learn more about their disease. They wanted to be a more active role in helping them to be healthier, which is why information and seeing your doctor and screening are so very important.
All right, Dr. Randy Fagin, thank you so much for being with us. We appreciate it and all the great information.
My pleasure.
And don't forget, we'll have Dr. Fagin on every other week. And if you have a question for him or a topic you'd like him to discuss, log on to KVUE.com and go to our web link section. Ask him your question on his website and he'll answer it in the coming weeks.